Foot, leg, and hip injuries, you know, they're a common problem that can be extremely difficult to overcome. Well, you got to walk, you know, and so you're constantly hurting yourself over and over again. However, some new state-of-the-art technology that recently arrived right here in Houston can really speed up the healing process.
It's helping everyone from professional athletes to people who are elderly. We learned about it while covering a special story on a man who traveled to Houston for extreme surgery. A surgeon at Houston Orthopedic and Spine Hospital was able to pull off the rare surgery, and this is a great part. He did it for free for this man from Guatemala.
Awesome.
Lay back for us.
Okay.
Dr. Brian Parsley met 49-year-old Raul Leonardo Sagastui Herrera, or Leo for short, through his medical mission, Faith and Practice in Guatemala. Dr. Parsley quickly realized the extent of Leo's medical needs was far too extreme for him to perform there.
He has been challenged like few patients have been challenged in their life. Starting at the age of 18, he was diagnosed with bone cancer. And when he had his bone cancer, his family still had the capabilities to bring him to the United States, which he did, and he underwent his first stage of treatment, which at that time was the removal of the upper half of his thigh bone and replacement of that cancerous bone with an artificial prosthesis that was a substitute for his hip.
Because of typical wear and tear that only lasted about a dozen years, Leo was able to undergo surgery again when he was about 30, but he got a severe infection that required multiple surgeries to save his leg and life. For the past 20 years, Leo has been in extreme pain until now.
With the grace of a tremendous amount of support from the implant companies, from the hospital that I work at, and certainly my services and the services of the other anesthesia doctors and assistant doctors and medical doctors, they all donated their services and their equipment to allow us to take care of him, which was a real blessing for Leo.
So happy. I think that's a miracle. I feel we, my family and I, and the people who loves me, we are very, very happy.
Dr. Parsley says during the 5-hour surgery at Houston Orthopedic and Spine Hospital, he started at the bottom of Leo's leg and just worked his way up to the damaged hip.
We're able to initially start with his artificial knee, which was the biggest challenge for us. And once we were able to restore the bone in his upper calf, then we were able to build on the artificial thigh bone and redo his hip, and then bone graft the damaged bone in his pelvis.
Dr. Parsley replaced all of the hardware in Leo's leg, plus added a new prosthesis.
This is his artificial femur, and this is all metal. And then this couples with a hinged knee, and then here's his upper calf bone. And you can see he's broken the bone out here, and the bone is actually eroded away too. So this piston's inside there. So here's the broken bone out the back. And now you get a better idea of what that whole femur, and it goes all the way to his hip joint. And then here's his hip joint. You can see it goes all the way up there, and it just pumps in. This has worn the plastic, and this is where the bone is eaten away. And so it's just barely gripping on this part of the cup. We cratered this all out, and then was able to bone graft this defect with particle bone from the bone bank.
Leo is anxious for his family back home to see his progress. He says this is all a real life changer.
I think my quality of life is perfect, it's 100%. I feel very comfortable with me and myself. I think I can do almost any kind of job.
Leo's rehab is as state-of-the-art as it gets. Check out this anti-gravity treadmill that was developed by engineers from NASA. They actually zip Leo into the device so that it can lift up his body and defy gravity.
It's going to take as much of your body weight off of this. So you know you're 50% weight bearing right now, right?
Uh-huh.
I can take 50% of your weight off, and then you can walk just like normal, without crutches or anything like that.
What does it feel like to be walking that fast?
I feel
crutches?
very nice. I feel very, very good, very comfortable.
So it's not painful?
No painful at all.
How long has it been since you've walked like this and this fast?
How long? 30 years. 30 years.
So is it surreal that this is you doing this?
I think so. I watch myself, yeah.
Do you hope to walk like this without the anti-gravity treadmill someday?
Oh yeah, I feel like walking someday, yeah. I'm going to work on it.
At this pace, Leo says he could run on the moon. Isn't that an amazing device? They just pumped it full of air and it literally lifted his body up.
That's incredible.
And again, without crutches or anything. He hadn't walked in 30 years and he was just overcome with emotion.
What a great story. Those x-rays were incredible. I didn't know that they could replace whole bones like that. I mean, I've heard of people getting plates and screws and things like that, but I didn't know that they could replace his whole bone.
It is just incredible. His whole leg was replaced. They did some unbelievable work. Very few doctors in the country can do it. So the fact that it was done right here,
for free,
even more impressive for free.
That's awesome.
Is actually Dr. Parsley's 18th year of medical missions. He has even more trips on his schedule. It's quite busy. I so want to follow him in Guatemala and see a follow-up there. But he says it's cases like Leo that obviously keep him going back to more to make a difference in other people's lives.
Awesome story.